Since 2002, heroin-related overdose deaths increased by about 300%. Among new heroin users, 3 out of 4 reported having abused prescription pills.
ABC 17's Ashley Strohmeyer has been digging into the connection between heroin and opioids for the past 8 months. She gives us a look into the growing epidemic of heroin use and deaths in mid-Missouri in this special report.
You'll recall this past May, I did a special report of a prescription drug overdose. Now I'm talking to mid-Missourians who say heroin has directly affected them. Take a look at this picture, for instance. This is a picture of 2 parents passed out in East Liverpool, Ohio, at an intersection with a child in the back seat after they've used heroin. Now, Ohio may be 3 states away, but the deadly impact of heroin is also hitting home right here in mid-Missouri.
I lost a son in September 2011 to a combined Xanax and heroin overdose.
You were taking it and thought you were going to die?
Yes, I did. I was not breathing. I had no heartbeat. I basically died.
Jim Marshall lives in Columbia. He lost his son Cody to heroin. I spoke to another mid-Missouri woman. She asked not to show her face, who's been addicted to heroin for 4 years. Because of heroin, she almost lost her life and she went to jail.
Even through all of that, I still came out and got high again.
She says it all started when she was given a prescription pain medication by a doctor when she was 16. It wasn't until about 10 years later when she tried heroin for the first time. Would you say you got addicted after the first time?
Absolutely.
Both Marshall and the woman say prescription pills played a role in the way heroin has affected their lives.
For most people, I would say that if you're addicted to pain pills, it is only a matter of time before you become addicted to heroin.
She says the pills are expensive, but so is heroin.
I was spending $200 a day. Easy.
A day?
A day. $200 a day on heroin.
Marshall says when people think of an overdose, they think someone has to use a large amount of heroin to die.
I know that when he passed, the toxicology report said it was a tiny, small trace that he had in his body.
He wants to use Cody's story to educate others on the dangers and effects of heroin use.
You're never the same after losing a child, but it has motivated me to use his story to help others and helps keep his name alive.
University Hospital emergency room doctors say they've seen a steady increase in patients coming in for heroin overdose.
Heroin actually covers all age groups. I mean, we see people as young as in their teens to sometimes even older adults who use heroin.
However, according to the Missouri Department of Health and Human Services, the male rate of heroin use involved deaths were about 4 times the female rate. In particular, white men accounted for more than 75% of heroin overdose deaths. Law enforcement says being thrown in jail is not the only thing you have to worry about if you're caught with heroin.
And heroin's mixed with all of these other items that we don't know about. There's no product control. There's no safety. I mean, this is an illicit market, and we see year after year that people die of heroin drug overdoses.
Sergeant White also says heroin users come from all ages and socioeconomic backgrounds.
It is a disease that I cannot control, in the fact that if I could turn it off, I would turn it off. If I could tell it to stop, I would make it stop. Nobody goes out looking to be a drug addict. Nobody. I have yet to meet someone that enjoyed this life.
Since we started promoting this story last week, I've had numerous people contact me about heroin use. I've had people share their stories of addiction or even how they've lost loved ones from heroin overdose. There was one thing in common with each story I was told. Every one of them said they want to spread the word about heroin epidemics and how something needs to be done to stop it.
According to the CDC, in the year 2014, more than 1,000 people died from drug overdoses in Missouri.